pathology and toxicology, primarily in hematology. A lot of big words here, Sam. Clinical chemistry, coagulation, urine analysis, and automated bioassays. Sam studied laboratory medicine. I'm butchering this, aren't I? Sam studied laboratory medicine at the University of Washington in Seattle. He worked as a clinical laboratory scientist at UW, University of Washington, those of you who don't know. Hospital and Harborview Medical Center before becoming scientist at ICOS and Amgen. He retired from his career in 2014 after a bad fall and being in a coma. His brush with death refocused him on his real mission of true health. Sam now travels the world teaching people to take care of their health, bring it back, and bring their own hands in reducing the many risks of factors that cause chronic disease in all age groups. So I want to welcome Sam, and we also have Dr. Brunel. And Dr. Brunel went to the University of Loyola Marymount, right here by my house, actually. He's a doctor of chiropractic for the Southern California School of Sciences. And he's been in private practice for more than 26 years. He's had more than 33 private clinics and sold currently, and also sold some of them. Currently, he has 21 clinics, a major hub and training facility in Corona, California, for medical integrative clinics, has coached and trained MDs, doctors, chiropractors, acupuncturists, physical therapists, and nurses to all work under the same roof. And has been teaching seminars for 25 years, and now stem cell regeneration medicine for over 8 years. And his clinics have done over 8,000 injections. Now, Dr. Brunel also, I've been working with him too, and he trains a lot of people, a lot of these doctors in how to do stem cell and stem cell rejuvenation. So I want to start off with Sam. Sam, you want to give a little bit of your background and your story about how you came on your journey?
Yeah, so I like you said, I spent all my career in pharmaceutical research, and being and working in toxicology, I just got it in my head that started asking questions like, can we make something that's non-toxic and actually keep people healthy so they don't need to take all our medications? I had this in the back of my mind this whole time of finding the cure and finding the solution. But unfortunately for me, spending my time in industry, I just, realized that it was a business, and I didn't want to, plant my flag there. I wanted to plant my flag into wellness and keeping people healthy. I think everyone that goes into healthcare is inspired by, something happened to their family or something that happened to their relative that inspired them to go into healthcare. And so I was, I really wanted to focus on that part of keeping people healthy. And so after my near-death experience, I fell when I was skateboarding with my kids. I wasn't wearing my helmet. I had a helmet, but I didn't practice prevention and didn't put my helmet on. And so I hit my head and went into a coma. And so after that experience, heaven is a real place. Heaven is all love and acceptance. And then coming out of that, it changed my personality. It changed me. It changed my focus. And I wanted to teach people how to stay healthy, how to preserve something before they lose it. Because I think health is just like time. It's only valuable once you lose it. And so that's what I've been doing the past, since retiring in 2014. I left the industry and I haven't been back. And so it's a good business, is a much better business being in wellness.
Yeah, rather than sickness, right?
Yeah.
So Sam, when you actually got out of what you were doing, what happened? I mean, what were you taught before, and what did you learn from that to what you're doing now?
So I was taught that healthcare is we come in and we offer treatments. We help people manage symptoms once they have symptoms, right? But what I learned after my fall was I need to focus on staying well and preventing symptoms from coming up. And so it's a different paradigm. The whole paradigm of treatment once you get sick as opposed to staying well. It's a no-brainer for most people. No one wants to get sick. So for me personally, I just started looking at food, water, air, chemicals, and how to keep all those things clean so I can keep my body clean.
Mm-hmm. Okay. So what's one of the biggest discoveries that you've actually seen is as far as like disease prevention and getting your body healthy, being able to get the immune system built up? What have you discovered?
Well, funny it is, one of my friends introduced me to Kangen Water a few years ago. And they said, hey, Sam, you used to be a scientist, right? Could you help us look at this technology from Japan? And I frankly kind of rolled my eyes and said, come on, you're pulling my leg, right? This isn't real. This is all like hippie stuff, right? But I started to look into research, look on PubMed, and it kind of dawned on me that, wow, there's some science to this. There's some truth to this. And so first thing I did was just change that one component, water, the water I was drinking. And so it's a very simple change, but it's had some pretty profound impacts for a lot of people, and for me too. I used to get a lot of migraine headaches, and so ever since being on this, I don't know what the exact mechanism for my migraines being gone, but they're gone.
So you're suffering from migraines before?
Yeah, I was suffering from migraines. I used to take sublingual tablets, and then I would get triggered by, lack of sleep, or I wasn't triggered by certain foods, but an irregular sleep pattern would trigger my migraine headache. And so once I started drinking this water, I wasn't, I was having pretty normal sleep and no more migraines in the past 4 years. So
what do you contribute that to?
I think balancing certain things out of the body, getting the hydration correct, getting antioxidants into my body, and reducing toxins possibly, and using the simplest thing possible, right, which is water. I mean, I think we're all supposed to be vegan and vegetarian, but those things are a little tougher to do. But I drink water like the best of them. So, all I had to do is just drink my water.
So that was the base. And you've taken other drugs before for this headache that you've had, these migraines that you've had. Yeah. And were you getting any success with that?
There is some success, but it wasn't. It was more like a treatment after you get the migraines. So I was, you'd have to be triggered and then suffer the migraine and then go and take something. I was looking for something to prevent, because everything has a cause. I don't want to just go into old age having all these symptoms. I want to be asymptomatic as we deal with, health issues coming, right? And so I want to be as healthy as I can for as long as I can.
And so you've been giving this water out to other people and sharing it?
Yeah, I've been sharing it every day, and I do a lot of things on social media now to help promote this. It's something that we'll be doing for the rest of our lives. Obviously, no one gets off this planet without drinking water. So everything and everyone on this planet has to drink water. But unfortunately, there's a lot of pollutants in our water, and it's been the lowest bar. I mean, my friends ask me if I still drink that water, and I'm like, I'm going to be doing this for the rest of my life. And then if you're still breathing air, then you need to be drinking water too, I guess.
It sounds like you got a real passion for it, that you're able to actually quit your job and want to do this, get this out to people. It's not just a thing for money, because you were making great money in Amgen, weren't you?
Oh yeah. I mean, I was over 6 figures, but there's something that I didn't feel that was satisfying my passion, my hunger for making a big impact on the world. And I think I can make a bigger impact with this than with, coming up with another pill. We already have too many pills in our society. We just don't have very much true help.
Mm-hmm. And what the pills are they just going after the symptom?
Pretty much every pill is going to be specifically geared for one symptom or another, but they they can only be so specific, and then that's why you see the drug commercials with all the side effects. And so they're targeting a particular issue, a particular symptom, but it has off-target effects, you know.
Okay.
So,
as a scientist now, dealing with drugs and things that are going to help people, through all your knowledge and your experience, what is the best way to guard against pandemics, disease, sickness, and things like that?
building your immune system. There are only two cures in the world, right? Your immune system and Mother Nature. And if you can support those two things, you're not gonna need a lot of treatment. If those things are out of balance, if your immune system is out of balance, your homeostasis is out of balance, or you're out of balance with nature, then that's when you start exhibiting signs of breakdown, signs of disease. And that's when you need treatment, so that's, once you cross that bridge, that's not a prevention area. You need treatment, go to the hospital, go to the doctor and get treatment.
So how do we build up our immune system?
What you eat, what you drink, and detoxifying your body from the modern chemicals and our food preservatives. There are three things that cause pretty much all diseases in mankind, right? You have oxidative stress, which is the number one disease for oxidative stress is cancer, and that's increasing because of how much chemicals that cause oxidative stress in our society. The second thing is acidic stress, and most of our food is processed now, and so we have a lot of citric acid and other food preservatives in our food to kill bacteria. So we eat that, and it kills our bacteria inside our gut, and it adds an acid load to our body. And the third one being dehydration. Everyone's drinking, coffee and energy drinks and all this soda pop, and it's dehydrating everyone. And so if you can eliminate, or you can do something to eliminate those three primary causes, you don't have to worry about any pandemics or influenza, because your body is innately geared to fight these things.
Mm-hmm. And what have you found is the best thing for your body in order to get all that?
Yeah, this right here. This is what I drink all the time, right? So I have this all, with me all day, every day. When I go on vacation, when I go to, I was just in India about a month ago, and we had a Kangen machine over there. And so it's basically water that's been shocked with electricity to make it alkaline, high in antioxidants, a negative charge, and it's been restructured so I can absorb it into my body and detox, basically.
Detox, okay.
Detox is the thing.
And how does that water build up the immunity in your system?
You have these reactions inside your body called redox reactions, reduction, which is stealing reduction is donating an electron, and oxidation, which is stealing of electron, right? And so if you can consume lots of fruits and vegetables that have antioxidants that can donate an electron, then you'll have a better immune system. You have better, ability to stay healthy and fight off disease. And this water is very, very high in electricity, in those electrons. And so you end up quenching out these free radicals and getting them out of your body and staying healthy.
It's actually studying Dr. Henry Konda, who won the Nobel Prize for his study on the Hansa people.
Yes.
And the Hansa people lived to be 140 years old and having babies in their 80s
Yeah.
with very little sickness or disease. Okay, they're pretty much disease free. It's microclustered, and it's very, very alkaline, formed naturally through the glaciers.
Yeah.
So does this water actually have those properties?
Yeah, it has those exact same properties. Unfortunately, most of us today, we're drinking from water sources that are not very pure anymore. You're drinking from city water. Bottled water has microplastics. You're drinking, soda pop, which has, high fructose corn syrup. So we're getting a very high load of oxidizers, things that are free radicals inside our body. And as a result, we have all these symptoms of disease, right? We have all these conditions. And so if you can maintain a clean body, a clean, clean air, clean food, clean water, and clean shelter, pretty much you're going to have a clean existence.
I was also told by a doctor that you basically couldn't eat enough fruits and vegetables throughout the entire day to get the amount of antioxidants you get just one glass of the water.
Yeah, exactly.
And then I also read too that according to the National Institute of Health in Washington, D.C., they came out and said the amount of antioxidants you maintain in your body is directly proportional to how long you will live.
Exactly.
So this helps fight off sickness and disease.
Exactly. Because we're restoring homeostasis, right? When if you take a condition, let's say like your car, right, John? So if you don't change the oil, right, or if you don't change the air filter, and you basically neglect the car, you don't wash it, you don't wax it, that vehicle is going to break down. And the same thing with your car, your body, right, your 80-year car. The same concept. If you don't eat the right food, but the foods you eat are full of chemicals, full of toxins, acid, free radicals, then pretty much you're going to break down sooner. But unfortunately, you can't get spare parts for this car. You can buy a whole new car, but you can't get spare parts for this car.
Well, I just think it's mind-boggling because if one glass of the water is more antioxidants than a whole bucket of kale and blueberries, and I'm drinking usually 10 to 20 glasses a day, those antioxidants are just flooding my body and binding to those free radicals, which causes the disease and sickness. It basically flushes them out of your body. So it neutralizes them and then dispenses out of your body, which is unbelievable.
Yeah,
now,
it's a
Dr.
very low
Brunel,
bar, right? It's a very low
welcome.
bar.
I know that you and I have known each other for over 10 years, and we've been working together. And he's got a huge clinic, and he has 21 right now clinics, and he does a lot of training for all over the United States for these clinics. Dr. Brunel, you want to tell us your story on how you came up about this?
Sure. Yep. You made me buy the machine. No, I'm joking. Actually, I've known the health protocol very early in my career. I was a big advocate of drinking water. I knew early in life, you are what you eat, but you're even more what you drink. And as I started to see the popularity of bottled water starting to happen, I knew enough to realize that plastic was not the best way to store it, and everyone was drinking it can, stored in plastic. And then you came along, and you started to tell me more and more about this Kangen water. And at that point in time in my career, I had, mainly one clinic, but I was pretty caught up in it. And then through your persistency, I just started to listen to what you had to say. I'm like, you know what? Let me look into what John's talking about. I did my due diligence, my research, but the proof was in the pudding. You actually put a machine in my clinic, and I started to have patients start to drink it. I started to drink it, and I just started to notice my skin starting to clear up. What was really amazing is I started to see patients starting to feel well in all of their conditions, all of their pain. And then what I realized what was happening is they were actually getting hydrated. And what I didn't know at the time was the statistics of dehydration. How many patients were dehydrated at that point in time? The average United States and here alone is almost greater than 75%. So if the patient was hydrated, I knew they would heal better. And I just started to become a big advocate of it in my patients. And now I put them in all of my clinics. It's actually the first thing that they do once they become a patient is they need to drink the water. And then hopefully they get a unit for themselves at home, and they have it for themselves always. So that's kind of where I started with the water, but that's kind of what your question was.
So why not just drink any water? Why not just give them tap water? Why is this one?
Yeah, like we know, it's not just hydrating with proper water. It's not just water. It's the type of water. And now there's other types of different companies out there, but no one comes close to this. The ionized alkaline water and the way that Kangen makes it is just a superior product. And it's just the way to go. I've learned it, and it's only gotten better. And this type of water that truly hydrates the body, that gets into the cell and gets out of the cell just as important, is what's happening with their patients through ionized alkaline water.
Now, you also deal a lot with stem cell and
Yeah, well,
cytokines.
yeah. So that was, we're going back when I first started to get into it. And then I started to become a medically integrated clinic where I brought medical doctors, osteopaths, acupuncturists, physical therapists, nurses, nurse practitioners in my clinics. We started to work together as a unit with the goal to rid the body of pain naturally. See, I as a chiropractor know that we don't want to just treat symptoms. We want to get to the root and the cause. And water helps with that dramatically. And then the evolution of stem cells started to come in. Stem cells have been around over 50 years. We just didn't know it. It was mainly derived through what we call bone marrow transplants for leukemia and bone cancer. But it started to derive for you, given to the orthopedic means now about 10 years. The unique thing about ionized alkaline water is one of the reasons that stem cells work so well and right away is they have this chemical, this cell called cytokines. And cytokines actually reduce inflammation. Well, ironically, ionized alkaline water actually elicits your own body's cytokines. So that starts to reduce inflammation, which is one of the reasons that you start to feel good when you drink ionized alkaline water. It's the cytokine properties reduce inflammation. And then with your own body's stem cells getting injections, those cytokines are kicked in conjunction with the water, you get a double effect. So that's one of the reasons. And stem cells are just the wave of the future. Regenerative medicine is the wave of the future. And in conjunction with ionized alkaline water, it's a great marriage.
Yeah, I got the stem cell done at your clinic. Amazing. I feel so much better. Knees feel so much better. It's been wonderful. But I also know that when you drink the Kangen water, it greatly increases the production of antioxidants from your liver as well, as opposed to any other water. And that's phenomenal too. Now, Sam, coming back to you real quick, as far as the other property in the water, which is the alkalinity, why is that important to the body in preventing disease or sickness or any type of anything like that? Why is that so important?
Basically homeostasis, every process in your body is a chemical reaction. And when you have those reactions, you have buildup of toxins, you have buildup of acid and things like that. Well, your body will keep up with that to a certain extent. But if you're also inputting acidic drinks and beverages and stress and things like that into your body, at some point your body will not be able to keep up. And then you have buildup of these toxins. And so then you have, a breakdown in certain organ systems to clear these toxins out. And so over time, it just adds up. And basically, every disease or condition out there is basically like the check engine light in your car. So, for example, let's say if you have the low fuel indicator in your car, if that comes on, and some people might say, well, the problem is the low fuel indicator. But for us to use common sense, we what's the real problem there? Your gas tank almost being empty. That's the real problem. And so if you can address not the symptom, the indicator light, but you address the root cause, then you can eliminate whatever is plaguing you, right? Whatever is the condition. So, but basically this helps your body with homeostasis. And so there's this thing now called homeostasis medicine, where you restore balance to the body. And in restoring that balance, you eliminate a lot of these symptoms. Mm-hmm. Right? So that's why it's important.
So we should, well, I've tested the water before, and I found it's about 100,000 times more alkaline than Aquafina, Dasani, Costco water, etc. How is switching from like drinking one of those brands to the Kangen water? Because I know that our bodies are 70% water, yeah. and replacing something that's 100,000 times more alkaline, how does that work?
Yeah, so this is different because a lot of people don't know that the pH scale is a log scale. You know, when you go from 7 to 8, you're actually 10 times more alkaline, and then when you go from 7 to 9, you're actually 100 times more alkaline, right? So every number up is 10 times more alkaline. But most people don't realize that what we're making here is OH minus. We're making alkaline water using an electrical charge. You're not using baking soda, which is a chemical, you know, that needs to be filtered by your kidneys. And that's going to cause a load for your kidneys. So there are many alkaline waters out there in the stores. You see them at Costco, you see them in various places. But this is electrical. That's why it's different.
I've seen a lot of those. I went to the store and literally saw 11 brands of alkaline water in Whole Foods. How is this different? Because I also found that the Mayo Clinic says you shouldn't drink that water for more than 2 weeks because it calcifies your body. You want to expound on that a little bit?
Yeah. So they actually add a lot of calcium carbonate. They actually add a lot of bicarbonate. You know, things that minerals in there that will essentially bring the pH up, right? And so what happens is you have an excess of these minerals coming in, and all these things have to be filtered by your kidneys. Your kidney is basically filtering everything. So it actually becomes it increases the risk of, you know, kidney issues, kidney failure, kidney stones and whatnot, because you have to stay in balance. The main difference is when you go to those stores, you can get a bottle off the shelf, turn it around and look at the ingredients. You'll see calcium carbonate, you'll see bicarbonates, you'll see minerals being added, right? Well, every other animal on the planet drinks mineral water, right? They just get it from lakes and streams. So do we, right? Essentially, all the water that we're drinking is coming from a river somewhere, right? But it doesn't come with added minerals and things like that. We already drink mineral water, right? But we need to take out all the impurities, and when we shock it with electricity, that's when we put the water into OH minus, and that brings the pH up. And so it's electrical instead of chemical, for sure.
So get our bodies alkaline with this water so it can increase our immunity system and also the antioxidants to fight off, get the free radicals and the damaging elements out of our body. Now, I also noticed too that when people go to the hospital in Japan, one of the first things they do is they check your alkalinity, which they don't do here.
Yeah.
Why is that?
You know, because, you know, their healthcare system is geared a little bit differently, right? Their healthcare system is a socialized healthcare system. So they want to look at root cause, because if you get sick in Japan, it costs the government more money, right? So they want to see, what have you been eating? What have you been drinking? You know, how's your BMI, your body mass index? You know, how's your weight? How are you as a vessel? You know, because if you're abusing this body of yours, then it's going to cost the government more money. You know, so they need to address what's going on of your system. Over here, it's a little different. There's no questions about how much coffee do you drink each day, or how many super big gulps did you have today. There's no correlation between health and food, which is a huge oversight. Everything we have to do in health has to do about food consumption, right?
So I noticed also, so we got the antioxidants, the alkalinity, which is very, very important. I also noticed when a person goes to the hospital, one of the first things they do in the United States is they put an IV in them. They start pumping them with water. Dr. Brunel, you want to talk a little bit about that, since you're a doctor, as far as, you know, they get the patient in the ER, wherever they are, they always put that IV in their arm to start hydrating them. You want to talk about that a little bit?
Well, yeah. I mean, you know, what they're doing is they're preventing the patient from going into shock. Again, you know, one of the first things you do is you get an IV, and it's loaded with electrolytes, and it's to prevent your body from going into a shock so you don't pass out. That's one thing true. It's hydrating the body, which again, most of the patients that come in are absolutely dehydrated. And on that note, speaking of that, I just also wanted to say something along the topic it's separate from what you're going into.
Sure.
In all of our clinics, we don't put in hand sanitizers. And there's a reason for that too. If you look at the average hand sanitizer that's out there, it's loaded with about 28 different chemicals, of which the strongest and actually the most lethal is alcohol. And those things create harm to the body, especially for the children. And in our clinics, we use the negative 2.5. And the reason we do is because we find that to be a nice sterile substance that cleans all bacteria as well as all viral components. And that is done not only for our patients in the office, but also this is how we clean the office countertops, how we clean and keep the aesthetics. And it would be great if we saw this with more hospitals. But I just wanted to mention that as we're talking about cleanliness and aesthetics and antiseptic issues right now as well.
Yeah. We're getting a lot of people these days going to the store and buying this antiseptic, these hand sanitizers, things like that. They're putting it on their skin all over the place. And so, Sam, what's going on there? What type of chemicals are actually going on as far as, I know Dr. Burnell touched on this and how harmful those hand sanitizers are. What's going on?
Yeah, so you've got, primarily it's a lot of alcohol, 70% alcohol, isopropyl alcohol. And then you have other scents, other smells that are in there too. You've got some stabilizers that make it into a thick gel so it doesn't degrade. And so all these chemicals are going to actually, when you use hand sanitizers, it actually absorbs into your skin. And, the people that use hand sanitizers a lot are people in healthcare, right? And healthcare people actually develop this condition called contact dermatitis. And so basically using these chemicals so often, their hands become cracked, their fingers become cracked. And it's very hard to heal, especially if you're wearing gloves and you're putting on gloves and on and off all day. And every time you deglove, you wash your hands. So you're washing your hand 20 to 40 times a day. And then you're in between there, you're doing hand sanitizer. So we're not built for that, unfortunately. And so, just a massive amount of toxins coming into each person, and it's quite a risk. But these chemicals are forever chemicals. They're going to end up in your bloodstream, essentially.
Yeah.
And so that's a big risk,
Yeah. That's why I like to use the 2.5 strong acidic water. It's actually 100 times stronger than bleach, killing bacteria and germs, because all bacteria and viruses. And whenever I go around these days, I just take that bottle with me. If I'm at the gym, and just spray my hands down, and you can actually drink it. You actually drink like a half a gallon of it. It's actually safer to drink than a Coca-Cola. And I spray it in my eyes. I get pink eye, things like that. But it doesn't cause any damage to the cells, which is, I want to explain that a little bit, Sam?
Yeah, so basically it kills in three ways, right? So it's a very low pH. Acid kills germs. That's why all your food has citric acid in it. That's why your skin is slightly acidic.
I was told that anything below 2.7 will kill all bacteria and all germs.
It'll kill, yeah. And then the second characteristic that it has a high oxidation number, right? So it has a high ORP, so high positive charge. So all organisms have to create electrons via the Krebs cycle or electron transport cycle to make energy, right? And if you can put a positive charge solution on that bacteria or that organism, you're basically going to take all their electrons and they have no more energy. And you have no energy, you're a goner, right? And what is the third thing? The third thing is the chlorine, right? So this machine is a medical device in Japan because it has salt. Salt is NaCl, okay? So what the machine does is it splits the salt, and the Na, the sodium part, goes up to the 11.5, and the Cl, the chlorine part of the NaCl, goes down to the 2.5. And that's what hypochlorous acid is, right? So it's HOCl, right? It's HOCl, and that's what. So the combination of those three things is what gives it the potency that it has. And one very good characteristic of this hypochlorous acid is that it doesn't leave any toxic residue, right? Because everything evaporates. The chlorine evaporates, the pH, because it's pH water, it just evaporates. And so over a few minutes, it's going to be gone. So right after you use it, you eat your food, you're not going to be ingesting some forever chemicals, basically, because those chemicals are on your hands. So,
and I know that usually disinfectants will kill the bacteria germ. This hypochlorous acid, better known as strong acidic water, or 2.5 acidic water, those three names for it, it actually gets let in through the mitochondria of the cell because it's water that kills it from the inside out. Is that true?
Yeah, so it'll get into the cell and it'll basically take all the electrons. And hey, let me share something with you here. I'm going to share my my screen with you guys here. Can you guys see this?
Yeah. Well,
okay.
It says you're sharing your screen, but Sam trying to started sharing the screen.
Okay. Yeah. So give it a second. It'll catch up here.
Okay. There it is.
Yeah. It is. So, Journal of Veterinary Medicine, right? And so one of my friends shared this research paper with me. And basically, they sprayed this hypochlorous acid solution to kill avian influenza virus, right? So it's very so this pretty much kills any bacteria, any virus out there. And so if you look at the authors on this paper, John, what do you see? What do you notice about the ethnicity or the country of origin of these authors?
Sounds like Japan.
Sounds like Japan to me.
Yeah.
And so they're always ahead of us. They're always ahead of us because they look for solutions that have alignment with their, with their society, basically. So, but, and let me see if I could pull up another one while we're on here. Here's another one here. So hypochlorous acid is ideal for wound care, microbicidal, antibiofilm, and wound healing. So basically, it's going to be very effective for all sorts of different conditions, right? So
also have a lot of doctors that use this in their office to disinfect and things like that. There's a dentist that I know of.
Yes.
The patient had surgery and the bleeding wouldn't stop, and it switched around with that water, the 2.5 strong acidic water, and the bleeding stopped.
Yeah. So here's another one killing another virus, killing norovirus. So, so this research, I share this, I share this research with all sorts of people, and so people know the science. There's another website coming up here, but and I'll share this with the group later. We can send this out, but it kills all sorts of bacteria, and it's been quite amazing for for people to understand these type of things. So, but it's so simple.
Right.
So let me
now,
end this here.
The last thing I wanted to talk about too is the beauty water that it makes, and I use that a lot. You use that too, and they call it beauty water for obvious reasons.
Yeah, for guys, it's called handsome water, right?
Yeah.
Yeah.
So you want to tell us about that?
Yeah. So your skin is about pH 5.5, pH 6. Your skin is slightly acidic. As I said before, it's for the purpose of inhibiting bacterial growth, right? And so when you make this beauty water that's pH 5.5 or 6 around there, it's pH matched to your skin. Okay, so when you hydrate your skin, this is pH matched because and it will absorb into your skin because the pH matches. Like dissolves like, right? And so when you hydrate your skin, you don't have cracked skin, right? When you have cracked skin, more pathogens and more germs and things that can get inside. But when you stay hydrated, right, that's the point of having oil on your skin, is to prevent cracking. But if you can stay hydrated, you're not going to be like a raisin. You're going to be more like that grape.
I noticed that my skin has got a lot better, a lot softer. And I had a friend of mine, she had all these sunspots all over her chest. I told her to use that water, and about a month later, I didn't notice any more sunspots. And it's for the hair, nails, everything is spectacular.
Yeah.
I love to use that before and after I shave.
Yeah, exactly. So we have these, melanin in our skin. We have these pigments in our skin. And all these pigments and everything in your body is moved around by water, right? And so if all those things are not moved around efficiently, they're going to get stuck in certain places, right? And so you're going to have age spots. And so if you can get this hydration, get this water in your body, it'll start moving things. It just works better overall as a system, as an organism, and that shows up in your skin. I know a lot of people use beauty products, but that's superficial to cover up blemishes, right? But if you are truly healthy from the inside out, it will show on your skin, right? People
Right.
look at you, it's like, wow, you don't have any wrinkles or you don't have any age spots anymore. What's going on?
Yeah.
Well, I just changed my water.
I've got so many women that come up to me and they're just like, oh my gosh, John, this machine is amazing. So many have told me the same thing. Their skin, their hair, their nails is so much better. Hair's growing better. It's just been phenomenal. So, I'm so glad that we were able to put this together because, in a time right now, Sam, where we have a lot of problems, a lot of things going on in the world, I just feel a lot safer just having this. And I know my immunity system is built up with this. Do you want to touch on that a little bit?
Yeah. Let me share something with you guys here that there's a lot of information going out there, and one of them is that coming out there with the pre-existing conditions. Is that coming out there, John?
Yeah.
So there's a certain age group, but more importantly, in any age group, if you have cardiovascular disease, diabetes, chronic respiratory disease, hypertension, cancer, if you have a whole list of these comorbidities, right, like these pre-existing conditions, you're going to be at higher risk for anything, not just coronavirus. You're going to be at higher risk for flu. You're going to be at higher risk for, food poisoning. You're going to be at higher risk for everything. And so if there's a way for us to build our immune system and actually restore the balance within our body by getting rid of toxins, we won't have these comorbidities, and we will actually be healthier and be able to fend off any challenges that come, and could put our health at risk. This is a website. I will also send this out later too. But if you look at the age range, there's a lot of fear right now, but if you look at the actual numbers of what's going on, and what age group is affected. So I don't think anyone in their, 40s with good health should lose their hair right now, should really wig out and just panic, So obviously we have to take care of our senior citizens that have health issues. But if you really look at what the risks are and keep it in check, because fear itself will decrease your immune system, right? Just being in this high stress, your cortisol levels are just ramped up. You're in a fight or flight mode. Rational thinking, critical thinking stops, and basically you go back to the crocodile brain and you start hoarding things. You do some irrational things, and that's what's that's what's going on with the world right now. I'm going to pull up one more graphic here, and this is keeping in perspective, right? It's loading here, but as far as actual numbers, okay, so if you see in the middle there, that one pixel, that one red dot.
Yeah.
So as of the March 19th, 2020, and this outbreak started over in Asia, mid-December, late December, somewhere around that time frame. So in 3.5 months, maybe 4 months, we've had about 10,000 deaths. But keep in mind, that's a certain age group, right, with pre-existing conditions. That's not nurses and doctors falling over, right? That's not 20-year-olds. But if you keep it in perspective here, and let me zoom out, okay? Let me zoom out in relation to other things. Okay, I'm going to zoom out slowly here. That 1 pixel compared to Spanish flu, compared to the bubonic plague, right, is not even in the same ballpark. It's not even the same discussion. But the fear that we have in our society is we're treating this thing like it's the bubonic plague, right? Yes, we have to have take safety precautions, but let's just not lose our minds and shut down the world, basically, right? Because in reality, I think what's gone viral here is the fear, right? Fear has had a bigger impact than the actual virus. Right. Mathematically, psychologically, I think the fear here is a huge huge problem for people. So I try to remain unbiased. I try to look at the math of what's going on, because we're getting information from all the news stations telling us the same stuff over and over again, 100, 1,000 times a day, and then we're just, every which way we turn, it's just bad news, and it's talking cases, right? I want to focus people on actual deaths. That's what I'm afraid of. I'm not afraid of cases. I'm afraid of dying.
Yeah.
Right. But
all right,
we're equating those things. They're not the same.
Well, when I first saw this, I'm thinking to myself, and I'm watching this demonstration on this Kangen Water. If you haven't seen a demonstration, you should really go see a demonstration. There's some good ones online. If you go to John Swartstrom on YouTube, I got one on there too. But there's a lot of different demonstrations on this. But I remember watching it for the first time, and I'm sitting back, and the whole time I'm thinking to myself, what would I do if I got cancer? What would that do to me physically as well as financially? Okay. And to me, the water made all the sense in the world. Mm-hmm. There's a doctor who won the Nobel Prize for cancer, and his name is Dr. Otto Warburg. And the fact is, he says, all disease, all sickness comes from, or loves an acidic environment. And he would actually take tumors in animals and found there's a blood supply that went into the tumor and a blood supply that went out of the tumor. And when he found the blood supply went out of the tumor, the blood became very acidic. So he'd take very alkaline blood, put it into the tumor, and find the tumor shrinking and going away. Those are facts. So I just feel so much better. I haven't got really sick that much at all since I've been drinking it. I feel healthier. I got more energy, and I sleep better at night. It's just been fantastic. And also the inflammation in my knees, feeling so much better. So, hey guys, I want to thank you, Sam and Dr. Brunel, for being on the webinar, and thank you everybody for taking part of this. We're going to actually get this on video. We'll send it out to you guys, put it out, and you guys, let's not make, like Sam says, let's not make this blow this out of proportion, especially when we see what other pandemics and other things have been going on in the world in the past. But also, wash your hands.
Yeah, and so someone asked about some of the things from the corporate telling us to be careful about what we share, and I think we should. It's a slippery slope if you start making medical claims and things like that. I primarily focus on the science. I focus on restoring the balance to the body and letting the body heal itself. I'm 3/4 water. Should I provide enough water to my body to do its work? And if I do, what is going to be the result? Now, I don't think drinking water is a medical treatment. That's just common sense. Just like eating food as opposed to eating junk food. Real food so we need to be very cognizant of what we say to people, that this puts your body into a state where it can heal itself. So we don't want to make any kind of medical claims. I do point to a lot of research and I say, hey, look at that research. That's what that says. And so if you want to try doing that, then that's what the research says. You know, but I'm not a doctor. Dr. Brunel is a doctor, but I look at the research and I look at data and statistics and numbers. And what we're trying to do here is we're trying to reduce your risk. There's a lot of risk in our society today. Food, water, air, even the cleaning chemicals at home are a risk, right? And so what I'm trying to do is I'm trying to reduce risk, personal risk and societal risk, right? And by looking at the actual numbers and what are we willing to do to manage risk.
Alkalize my body. This is the best way I've found out of anything that I've looked at as far as getting all that stuff.
Exactly.
And also the 2.5 strong acidic water, sanitizing my hands. Doesn't damage my hands. They actually feel moist and hydrated. So it's been fantastic. All right. We don't really have any questions right now. So I want to thank everybody for being on the call. Thanks, Sam. It's great having you. And also, Dr. Brunel, thank you so much, Dr. Brunel.
All right. Thank you,
guys. You guys later. Make it a great week.
Thank you.
All right. Bye-bye.
Bye-bye.